Okay, so today we're going to do the CBO for the AGM check. So the first thing you want to do when you come in is turn the top screen on. It's just a little switch there. And to turn the bottom screen on, you just want to turn this to on. When you turn that one on, it's going to do a self-test. It just takes a couple of seconds and it does it automatically. The next thing you want to do is check your anesthetic gases. So you want to take them out. To take them out, you just turn this little lock here to take it out, and there's a little trigger in the back. You just pull the trigger and it pops out. So you want to set it on a flat surface to check the level, and to check the level you want to just check to make sure that the gas is lined up with the top line here. You can see that on both of them. These are full, but I'll just show you how you would fill them if you had to. So you take the cap off that and get the gas out of the bottom drawer here. And you can see that there's kind of a little key on the bottle, and you just want to line that up with the key on the cartridge. So you just push it in, and you'll hear bubbles coming up through the bottle, and you want to just watch the level and make sure it's not overfilling or anything like that. And then when the bubbles are done coming up, you just take it out, put the cap back on, put the cap back on the cartridge, and then you're good to go. So to put it back in, you kind of have to push it hard to get it back in, and then you always want to make sure that you lock it back in when it's done. And the other cartridge goes under here, and it goes in the same way. You don't have to push it hard when you put it in here, and just make sure you lock it. And another thing is you want to just make sure you have the checklist. It's almost always on the side of the machine here. It's just something you go through every day.
Okay, so we're going to show you how to do the actual check first. We're going to bring that over. The very first check that you have to do is the low pressure leak test. So to do that, you need to grab the little bulb, which is always in the bottom drawer down here. So that's this little piece right here. So you're going to scroll down. These are all the different checks you have to do: system, circuit O2 cell, low pressure leak, and agent delivery. And we're going to go through all of them. So low pressure leak. You click on that. Each one of them has a list that tells you what to do. Make sure ACGO is selected. So the ACGO switch is right here. It's either set at, most of the time it's set at circle, but for this you have to switch it down. Switch it down and plug in the bulb. Okay. And then basically you have to squeeze it a bunch of times until it sucks all the air out of the circuit. You want to leave it so that basically you're going to leave it for 30 seconds, and you don't want this to reinflate. You want it to stay like this. There's a timer on the side here, so if you hit that, you'll see the little timer come up. So I'm going to leave it for 30 seconds. Usually when you do this, you come around to the back of the machine and you always make sure you check that there's a bag for emergency situations. If you don't check, they'll fail you on your CBO. You want to open the oxygen cylinder to see what the pressures are, which will show you, it comes up on the gas machine after. Usually turn it about 3 times. So open it 3 times, and I'm just going to close it again. 2, 3. I usually check the CO2 canisters, so they always have the extra one up here. And the one in use is always right here, and there's the collects water down here, so if there's water you can empty it, but there's nothing right now. The only other thing you have to check is on the wall back here, the medical gas alarms. You want all of these to be within the normal range. So basically you want them green. So to test it, there's a little test button on the side. You hit that, and yeah, they're all green. So we're good to go. So the 30 seconds is probably up. So yeah, it's been a minute. And the bulb's still pretty deflated. So yeah, so all you have to do is hit pass. And that's the low pressure leak test. You flick that off on the gas machine checklist. So back. So you don't need the bulb anymore. After you've done that, you're going to switch it back to the circle system. Okay? So the first check you have to do is the system check. So once again, it tells you what to do. Set the bag/vent switch to vent. So that's right back here. You can see a little picture the ventilator, and the bag. It's set on bag right now, so you're going to shift it over. You want the patient Y opened, so you want this open to atmosphere, and then start. So basically you just have to hit start. This one only takes about 20 seconds. So we're just going to let it go. Yeah, you can see that the SIVO is in, so it'll automatically detect it right there and tell you how full it is. If you were to place the desflurane in, it would be blue and it would say des up top. So this should be done. The second part of this, basically all you have to do is occlude the patient Y. So you disconnect the mask from the circuit, and on the side here, there's a little piece right here that you can plug this into to occlude it. There. So, and all you have to do is hit continue. This is the longest one, so it's about 4.5 minutes. So during that, we're going to show you the different parts of it. I'll show the parts, and then you do that. Okay. So, there's the bag and vent switch, which I already showed you. The APL valve is right here. It's, for the most part, it's set to min, unless you're going to bag someone. There's the ACGO switch, set to circle. O2 flush valve, which we're going to show you later. So on the front, there's an extra flow meter in case you need the bag, the volatile gas that's set up. Your suction supplies are right here, and your alternate O2 control is right there. You pretty much never use that unless the blender fails. Yeah. Anyways, so you go up a little bit. It's all. This is where all your blood pressure, sat monitor, heart rate, end tidal CO2, all that stuff plugs in right here. So we already showed you the cylinder on the back. There's the scavenging systems. Scavenging system is a little pink line which goes from here to connects to the bottom down here. You want to make sure that's connected for the check. And yeah, there's the patient bag and the bellows.
Okay, so another thing is the stuff over here. When the patients come in, you're going to be usually expected to hook up the ECG onto them. So you just take these, and there will be little connectors over here on the side to put on. So you just open that up, and there's three in there.
Sticky pads.
Yeah, just sticky pads. And a good way to remember where to put them on the patient is the white goes on the right of the patient, and then smoke over fire. So this one will go low, this one will go high. Another thing is the SAT probe. You'll usually be expected to put that on, just put it on a finger. And the blood pressure cuff, usually a nurse will do that or something, but you might have to too. You just put it on the arm, and it has a little arrow here for where the brachial artery should be. And you just put it on snug, but not too tight. Another thing is your suction is here. You saw the control on the side there. You always want to check that and make sure that you have good suction. And then this is the temperature probe. It has little adapters here to put on it. And some anesthetists use it, some don't. So if you need to use it, that's where that is. And your suction canister is down here. You want to make sure that everything's connected nice and tight so it doesn't come off when they're trying to use it. And another thing is, if it's not working, you want to make sure that this here is not to the off position, because then you won't get any suction. You always want to make sure it's on the on position. Another thing is all your supplies are up here. So you have your HMEs up here, your LTAs, stylettes, temperature probes, suction catheters, your BIS monitor, the light wand, which we rarely use, the yonkers, and suction tubing. And you always want to make sure you have a good supply of towels up top in case you need them. And you always make sure there's a box of Kleenex just for little wipe-ups. And there's extra blood pressure cuffs over here for the pediatric or infants. You always want to make sure they're there. That's on your checkout. So the test is almost done here. Yeah.
So the system check is just finishing up, and then we're going to move on to the circuit test. so that's done. Everything passed. Yeah. Okay. So now you want to go down to your circuit test. One thing you always do, you can do it pretty much any time. I usually do it at the very beginning. There's the one more test, the calibrate flow transducers. There's a little piece on the side right here. Basically, this part right here. There's a little switch on the bottom that you can pop out, and you just gently wiggle it out. So you just leave it outside its position for a second. You should see an alarm come up here. So no inspiratory flow sensor, no expiratory flow sensor. So that's all you have to do you basically plug it back in and it should go away, hopefully. There. Okay, see, some people do it at the very beginning, some do it in the middle, just as long as it's done. Circuit test, so you go down to circuit, hit enter. Okay, so you want to occlude the patient Y, which is still occluded down there. So you want it switched to bag, and set the ACGO switch to circle, which it's still set at circle, so point it up. Yeah. And then you want your APL valve between 30 and 70. You should hear the little click when it goes above 30. Yeah. So, and that's all you need for this one. So, 34 seconds. Yeah, I guess we'll just wait for this one to finish. Okay, so we're going to look at the sheet for a second. Basically, it's